Thank you for joining us for our press briefing today. Today's particularly important as we will be talking about the reopening of schools and what that means for Tennessee families, for our students, for our teachers. I have with us today Dr. Piercy from Department of Health and Department of Education Commissioner Penny Schwinn to go over those details. I know that there are likely a number of parents tuned in today, and we want to be very clear that what we want to provide for you are choices that you have for how you believe your children best should be educated, whether that is in person at school or at home. And we also know that we want to speak to teachers who we want to understand that we have a strong commitment to making sure that you can teach your kids safely and effectively, and we'll be talking about the ways that we are supporting our teachers in this effort. Many of our schools were forced to close in March due to the uncertainty of this pandemic. There was much uncertainty, there was much disruption to in-person learning and to extracurricular activities. And like the rest of the country, districts were thrust into a situation of learning how to support kids out of the classroom. And teachers had to work overtime to understand how to virtually teach kids effectively. Parents were thrust into a situation regarding teaching their kids at home and finding child care options for themselves. So we had a great deal of disruption in the spring, and the last 5 months have certainly pressure tested our health system. They've pressure tested our economy, but these months have been especially cruel to students and to children. And if we're not careful, we stand to have a generation of kids who are left to fend for themselves. Make no mistake, extended time away from the classroom is harmful to children. There's widespread agreement to that. It's particularly harmful for low-income students. It's particularly harmful for students with disabilities. And while many Tennessee students can learn in a safe, supportive home environment, we have to account for the student that cannot, the student that is in the inner city, the student with special needs, the student that does not have access to adequate nutrition, the student that has mental health challenges, the student that does not live in a stable home environment. And the school itself provides resources for all of these students, and we are committed to serving those kids. Commissioner Schwinn will have much more to say about this, but our Child Wellbeing Task Force explored the significant risks associated with prolonged time away from the classroom when it comes to safety and mental health and academic achievement and other considerations. So like the American Academy of Pediatrics, the CDC, the National Academy of Sciences, Engineering, and Medicine, we fully support reopening our schools with in-person learning as the best option. We also believe that districts should open on time and that planned delays should be reserved for only the most extreme situations. School reopening is not going to be easy, and there will be a temptation at times to throw in the towel or cut corners, but we have to remember this generation of kids that are desperately needing us to show up on their behalf at this crucial time in this crisis. The role of the state is to provide clear data. It's to empower parents in choice for their kids. It's to support teachers in their efforts to teach safely and effectively. And it is to work with districts to make certain that they have everything they need to develop their reopening plans for their individual districts. As we work toward the safe reopening of schools, there's also been a lot of discussion about the return of sports in schools. And today I'm signing an executive order that will also not only talk about reopening of schools today, but that the executive order will allow for contact sports to resume in Tennessee schools. We've worked with TSSAA to coordinate a framework so that football season and soccer season can begin. Non-TSSAA schools must follow those guidelines, and non-school sponsored athletics will follow the Tennessee Pledge, and the pledge will be updated to provide guidance for those athletics. It's an important part of our community, athletics, and it provides a lot of benefits to our student athletes, but however, we have to remember common sense precautions have to be taken in the midst of COVID-19 in order for any return to play to actually make it through the season. Additionally, I'll be signing an executive order this week that continues to give local governments the authority to determine mask requirements. Adopting mask requirements has been an effective tool to allowing buy-in from local citizens by their local leaders, and we are encouraged, as we discussed yesterday with Dr. Burks, the need for Tennesseans to wear masks and the need for us to implement policy that allows Tennesseans to grow in their adherence of this policy. Now we're going to move to school reopening reports. Dr. Piercy will walk us through the data and what we need to do to understand the risk associated with this and how COVID-19 spread is being measured. Commissioner Schwinn will walk us through the specifics for parents and students and teachers and districts. Department of Education and Commissioner Schwinn have thoughtfully built in measures that no other state in the country is providing, such as safety kits for 80,000 Tennessee classrooms to make sure that our teachers have the supplies that they need to open their classrooms safely. So let's begin with Dr. Piercy's report.
Thank you, sir. Good afternoon. Today's focus is on education, but I'm going to start and give you a little health background first as it pertains to our children going back to school. You know, when you think about school, it's normal. You probably think about education. But I want you to remember there's so much more that children get at schools in addition to an education. And as a pediatrician and a mother, I know we're all focused on the holistic well-being of the child. Let me point out a few things that kids get at school that you may not readily think of. One is physical health. You've probably heard us talk about the importance of nutrition and feeding when children are at school, but they also get physical activity there, and they get, in some cases, health care. So school is important for their physical health. And as the governor mentioned, and you'll hear more about, children get mental health care at school as well. 75% of all mental health services in children nationally are provided in the school system. Likewise, schools are a very important place for identification of possible abuse and neglect. And we all know that children not only enjoy but thrive when they have the social and emotional supports that they receive at school. And that's why the Centers for Disease Control, the American Academy of Pediatrics, and the National Academies of Science, Mathematics, and Engineering, as well as the Department of Health, all recommend a return to in-classroom learning. So the Department of Health has been assisting the Department of Education in how we can do that in the safest manner possible. I will remind you that multiple studies, and the CDC recently pointed this out, that children are primarily not the drivers of community and spread in schools. They're also typically not the primary source of infection amongst family members in a household. And we also know that children are most likely to either have mild symptoms or be completely asymptomatic. In addition to helping the Department of Education with reopening, we've also been assisting them in what to do when the inevitable case comes in school. You've heard me say that before. You know that there will be cases in schools. And so what we're trying to do is make sure that we have a very detailed plan so that when we respond, we can have mitigation of the spread as well as minimize the disruption that it might cause. And finally, don't forget the routine well child care. You know, this is the time of year that you would typically get your back-to-school physical and any immunizations, kindergarten shots, or middle school shots that you might have. And I want to tell you about something that's been concerning. Right now, We are 43% lower in immunizations than we were this time last year in childhood immunizations. That means almost half of the kids that should have gotten shots haven't gotten them. And I realize part of that is because of decreased movement and going about, but I want to reassure you, it's safe to go to the doctor or the health department, get your routine immunizations, get your back-to-school physical, and make sure you're taking care of routine well-child considerations. And last of all, have a great school year.
Commissioner Schwinn.
So we are officially in back-to-school season, which is typically a very exciting time of year. I know parents, families, educators, and students all anxiously await that first day of school. And this year is going to look different. You've heard that a number of times, but certainly as we prepare for back to school, we have some critical decisions ahead of us still to be made as school systems, and I am here to talk about some of the resources that we will be providing as a state to support our local district schools, teachers, families, and students as they enter this back to school time. I'm thankful to Governor Lee for continuing to support education in Tennessee as schools reopen across the state. And when we think about the new school year, the department's top priorities will continue to be ensuring safe and healthy schools for all children and staff and high-quality education for all students. We're also thankful to our partners at the Department of Health who have worked very closely with us in strong collaboration to develop some of the tools and resources that you will hear about today to ensure that all of our districts, our directors of schools, school site staff, and communities have the information they need to know how we are protecting our students and staff. The guidance, which has been posted on our department's website as of this afternoon, provides some clear considerations for school building closures based on community spread of the virus, because we want to make sure that districts have what they need to make the best possible decisions for their local communities. Schools are opening now for the coming year. We had our first school open last week, and we have additional openings this week that will continue through September. And so I want to talk a little bit about some of the resources and supports that we're providing. First and foremost, the Child Wellbeing Task Force has been hard at work to consider some of the implications of school building closures that happened over the spring and what needs to be in place as we think about going into this school year. Notably, I think very notably, especially for those who have been educators, we saw that there was a drop in 27% drop during the peak stay-at-home periods in reports of suspected child abuse, a 27% drop. 75% of students nationally receive mental health supports at school. In 2019, approximately 45,000 school-aged children were served for mental health through the community-based system, and over half of our districts said and talked about the challenges of providing these critical services when school buildings are closed. And I think very personally, when we think about what students rely on, what families rely on, millions of students over the summer, and reminder that many of our districts have been closed for almost 6 months, millions of students went hungry this summer. Many students in the state of Tennessee rely on our schools for breakfast, lunch, supper, and snack. And so it is critically important that regardless of what happens in terms of local decisions, we provide all of our students with these critical services and supports to ensure that they are taken care of. Also, when we think about the Child Wellbeing Task Force, they will be putting out a series of protocols and guidance documents in terms of what to do to support at the local level to ensure all of our kids have the whole child supports that they need. We also know that our parents are looking to us for guidance and support on how to help their children, especially when we think about going back to school. And so the department is continuing our commitment to some of these critical resources. Notably, we have an early literacy resource that was released. It helps with videos, at-home tools, et cetera, to support that early literacy work, which we know is really, really hard to do, especially in a remote setting. The PBS Learning Series, our STEAM Resource Hub, and the Start of Year Checkpoint. We know that with months and months of time away from classroom-based instruction, many of our students are going to experience significant learning loss, and that hits our vulnerable students more than anybody else. It is critically important that we know how our students are doing, and we have the Start of the Year Checkpoint to be able to measure what that loss is so that our educators are empowered with the critical information they need to support closing those gaps and accelerating student progress as much as possible. We also have done a lot of work around advocating for student needs. Technology-wise, the governor has committed $50 million in technology grants. That's 250,000 devices that will now be in our school communities specifically for students to close that digital divide. We know that many of our districts are investing local CARES dollars or their ESSER dollars towards this, but 250,000 additional devices to support student learning, both in a remote environment, but also when they are back in the classroom. We know that this is critically important, especially for our most vulnerable students. We also know that, as I said, meal supports and food accessibility is something that our students and families rely on. And so we will continue our partnership around the school meal finder so that all families have access to those food programs regardless of the seat that their child is in which they learn this year. As we think about supporting teachers, if we take anything away from today, I think it is that the health and safety of the folks who are in our schools, whether they are children, staff, or teachers, is the most important thing. And so the governor has very generously, and I think very importantly, led the conversation on what we are providing to educators this year. 80,000 teacher kits, classroom kits will be provided. That includes everything from a year's supply of face masks, disinfecting wipes, hand sanitizer, and other needs that teachers will have in order to ensure that they can keep themselves and their classrooms safe. We never want our teachers feeling like they have to take out of their own pocketbooks to make sure that they can keep their classrooms safe and healthy. We are the only state in the country who will be providing a teacher-specific and a teacher-driven classroom kit for the entire year for every teacher. 80,000 kits. Those will be distributed by TEMA, and we are very grateful for their ongoing and continued support in this space. School nurses will also be provided with surgical masks, gloves, protective gowns, and face shields, so that as they are providing those critical services to our children, they can keep themselves safe as well. When we think about our educators, we also know that professional development is critically important. We've heard the need from our educators and our principals and our superintendents about the need to make sure that they are ready for this school year. So the department has provided additional professional development series that will be available on our website for reopening and back to school. And that is on top of the previously released partnership with UTK for principal professional development. About half of our principals participated, and the Trevecca partnership for teachers, where over a third of our licensed teachers in the state participated. Again, providing resources for our educators to be able to meet the needs of this new and very challenging school year. And then finally, when we think about assisting our districts, we know it is important that as districts are making these critical local decisions, that we give them the tools necessary to be able to do that in an informed way. And again, very grateful to Dr. Piercy and her team at the Tennessee Department of Health for working very closely and collaborating with the Department of Education on what those tools are. So you'll see those on our website. Specifically and notably, we have a decision tree that will help districts make those critical decisions if a positive case is noted in the school. We know that we want to make sure that we take the necessary precautions, but that we also have a very clear protocol outlined so that families understand how those decisions will be made and what that means in terms of their child's classroom, their child's school, and their community. So you will also see a district action team protocol, which will help districts to move through those critical decisions when and if a positive case is noted at the school. We're doing a lot of work on instruction. I'm excited to be able to highlight next week some of that work as it relates to academics, because we know the two things that we are focusing on are health and safety as well as academics. But given that we are critically focused on health for this week, I want to end just by saying that we've got almost 1 million students in this state. We have tens of thousands of school site staff who are there every single day specifically for their children. This is a very, very big challenge that we face as a state and as a country, and we have to keep those folks who are in our school communities near to our hearts as we make these decisions. As I've mentioned before, I've got 3 kids, got 2 who are going to be in our public schools this year. And so when we're thinking about how we're making these decisions and the critical importance of that, please know that as a department, as a state, and I know in our school communities, we are thinking about all of our children as our own. And our most important task is to make sure that they are safe when they go to school, that they have a quality education when they are there, and they come home to us that much stronger and that much better. I want to thank the superintendents across the state, our teachers, our families, and our school communities who have been working incredibly hard all summer to ensure that we open schools as strongly as possible. We will do this together. Tennessee continues to lead in this space, and I'm very grateful for the ongoing support. So thank you very much, Governor. Yes, sir.
Thank you, Commissioner. A lot of information, very important time in our state's history. very important that we rise to the challenge to serve the kids of Tennessee who are also in crisis, along with the rest of our population. I'm deeply grateful for the work that Commissioner Schwinn has put in, but again, I want to reiterate how grateful we are to the partnership that we've had with districts. We have had regular communication multiple times a week for months on end to prepare for these days. So we're especially thankful for the work of the districts who have developed plans and are ready to reopen their schools. We're thankful to the teachers who have given invaluable input, and we're thankful to the parents who have given us feedback on how it is, what they want, what the choices they want for their children. I do think that we can lead in a way that will serve our kids well in these unprecedented times, and we are encouraged about where we are today in the process of getting our schools back open and getting our kids back in the classroom. We'll be happy to take questions. Dr. Piercy, Commissioner Schwinn, and others on our team if those arise for them, but be happy to take your questions.
Hey, Governor. This is probably a question for Commissioner Schwinn. The Alcoa Middle School situation, I just wanted to get an update on that. Have any additional people tested positive there? What has the response been? And was that a student or an employee of some sort? And then a second question, how many schools have indicated to the state that they anticipate opening in person on time? How many indicate that they're going to be delayed or virtual for some time, and how many are still up in the air?
Sure. So two great questions. So Alcoa City did have a positive case within the first couple of days of opening. That does let us know we got some great partnership with the Tennessee Department of Health, that would have happened outside of the school community just by nature of how that worked. The school, and I would say the superintendent, worked through their protocol exactly as outlined. So they made sure to notify folks. That happened within hours. They made sure to take the necessary steps to keep people safe. And so, again, I think as we're having these conversations, a reasonable expectation is there will be positive cases in schools. That is something that is going to happen. What is important is that we have all of the safety and health protocols in place to ensure that folks have the resources they need, and to make sure that we are going through the appropriate protocols. Alcoa City did do that. And then I think to your second question, which was?
How many schools have indicated they're going to open in person on time versus virtual versus ones that are still making decisions?
Sure. So as of right now, and we're currently reviewing what we call continuous learning plans. Those are plans that all of our districts are required to submit, as well as our public charter schools, that talk about what learning looks like in a remote environment to still count towards instructional days. As of today, 145 of 147 districts have plans to open in person for this year. Now, a number of our districts have delayed for 1 or 2 weeks, and for the most part, those districts have said that they wanted a little bit more time to ensure that their plans, they've gone through all of the plans to make sure that they have the resources necessary, the training and professional development supports necessary, et cetera. We're going to have a dashboard that will be publicly posted on the Department of Education's website, and that will give you real-time information on the status of every district, so you know who is open remotely and who is open in person. But as of right now, it's 145 out of 147.
Do you know how many are delayed at the outset?
I don't have the exact number on me, but at this point, we know that it's approximately a dozen school districts in the state.
And was there an additional COVID case out of Alcoa, or is it just the one person at this point?
The information that I have right now is around the one case that where that person would have had a positive case coming into the school year.
Thanks.
Yes, sir.
Thank you, Governor, and thank you, Commissioners, for talking with us today. I have a few questions. The first one is about teachers. So, Governor, you've talked about how you want to give parents the option of whether they're going to send their kids to in-person instruction or if they will have remote learning. What about teachers? I asked you this, I believe, last week. What are the options for teachers who are afraid for their health? Is there a possibility that they can stay home and still have a job?
So we have made the effort. The greatest focus that we've had with our teachers is to provide them everything that they need to be safe to go back. Penny has referenced the PPE and the kits and the guidelines for safety within their classrooms. Our expectation is that those teachers will return to work under those safety guidelines. There is, for teachers who have exposure and have to find themselves quarantined, there's federal guidelines around that pay for those teachers in that situation. But our expectation, our anticipation is that our teachers are, for the most part, going to come back to work.
Commissioner Schwinn talked about how the expectation is that there are going to be positive cases in the schools because of how this virus is spreading. So it sounds like you cannot ensure the safety of teachers, though. Can you?
Well, we can provide safety equipment for teachers to do everything we can to make certain that they're in a safe environment. Can we guarantee that a teacher may not test positive? That we can't guarantee that. We won't know where. We also don't know where cases come from. Specifically, that's difficult to track, but we're doing everything we can to create a safe environment, and our expectation is that those teachers will be returning.
Thank you. And I have one last question about contact sports. So we're seeing that professional contact sports are struggling to go back because of the COVID cases. What do you see different here in terms of schools? I mean, do you foresee some of these schools?
Well, I think, again, we'll see what happens when, as I said, our expectation is that if the guidelines by TSSAA are followed, then we'll be able to move forward with those contact sports. But we also know that reasonable, practical approaches have to be made, considering COVID-19, in order to be able to finish the season. So we will see how that develops, but our anticipation is that we can move through that safely.
Governor, earlier today there was a Nashville physician who was basically urging you to move to to do the statewide mask mandate and stuff. And he was pointing to your campaign and that your campaign he considers himself a Christian, and he was saying that basically he thinks you should be doing the walk and making these tough decisions from a religious perspective. As a man of faith, how do you respond to that?
I think what we're doing is making the decisions that we believe are going to be most effective in mitigating the spread of COVID. And that is a strategy of messaging around wearing masks, a strategy of implementing local leaders who have the trust of their local citizens. And as you heard Dr. Burks yesterday, support that effort and that approach. My belief is that wearing a mask is a safe way to keep our economy open, to keep our schools open, and the best way to implement that in a sustainable way is to use the targeted approach that we're having. So that's my belief, and that's my approach, and that's our effort, and we see it working.
Hi, Governor. One of the things you said earlier was you are putting this in place with a real hope that it doesn't leave any students to fend for themselves, I think was your quote. In Nashville and Memphis, there's perhaps the widest swath of students that are very well off and ones that really struggle because of their home environment. Would you recommend to those two school districts that are doing mainly virtual learning to open up targeted, maybe it's mental health services, maybe it's learning just for disabilities? And I ask you this because I see on here that there's an encouragement to, keep students and staff together in a group and make that be their group sort of as much as you can. And so I'm wondering if you could target that to things, even if students aren't in the classroom from 8 to 3, say.
Well, I'll let Commissioner Schwinn talk about our interaction with those districts, but I'll reiterate this. While districts are given the responsibility to make decisions about their own district, our belief, along with a national belief, is that in-person learning is best for students, including in Davidson and Shelby County. We're hopeful that those districts will move toward in-person learning when they believe that it's appropriate to do so. We think it's best for kids. We do believe that many of the most vulnerable kids are in those districts, and they're at the highest risk being out of the classroom. So our hope is that we can work with those districts to get them to implement in-person learning.
And Commissioner Schwinn, if I might follow up on the cohorting students and staff into small groups that remain together over time, how would you envision that looking? Do you have an example that you could give of that?
Sure. So I think there are a number of examples in terms of how different districts and schools are thinking about cohorting. The department's put out some pretty significant guidance related to all of the various options of what that could look like. So an example might be, let's say, an elementary school. You could have a group of students who naturally stay together, and you make sure that you have the one teacher who's with that consistent group of students. It gets more complicated, of course, in middle and high school, where oftentimes children are moving in between classes. And so one of the things we actually heard from one of our teachers of the year who said, here's what we're doing. We're going to keep students together in one classroom, and then we'll actually have certain teachers who move in between classrooms, allowing them to sanitize their equipment as they are moving. And she suggested that is something that's happening at her school that she helped to co-create with her school leadership. And so I think that's a good example of, if you want to make sure all children continue to have art, you can have that art teacher who is moving classroom to classroom, disinfecting and making sure the students stay together. You can have that for a lot of different scenarios, and we actually see a number of middle and high schools who are moving into that model where the teachers rotate but the kids stay together.
Governor, the CDC and the American Academy of Pediatrics has both said that the #1 condition that states should look at when opening schools is whether or not COVID-19 is under control in the state. It's not in Tennessee. How do you explain the decision to continue to open schools based on the current climate in the state?
I think the decisions to reopen schools are based on the health and safety of children. I think we've outlined the risks associated with children not being in school. We've outlined all of the dangers and all of the negative impacts that has on kids. And so we weigh our approach to mitigating the spread of COVID-19, which we are aggressively pursuing on a daily basis, with the need to safely put kids back in the classroom. This decision around in-person learning is based on what's best for kids. And that's how we've made the determination to move forward.
The CDC has also said that they believe that if there is a child or a teacher who is infected in a classroom, if there's a child or teacher who is infected in the classroom, that the whole classroom should be tested. Why not take that advice in your plan rather than potentially asking a child whether or not they've been within 6 feet of someone who has it for 10 minutes?
Yeah, so one of the challenges that we face right now in the state is, and in the nation, frankly, is testing turnaround time and the speed with which we can get results back from testing. That weighs into that decision, and we will be looking at, and we talked actually with Dr. Burks yesterday about testing strategies moving forward. But we think that the clear protocols that we've put in place that will be pushed out to those districts are going to allow for the appropriate steps to take whenever there is a case in a school to make sure that those kids are safe.
Do you think those children will be able to make those determinations, though? Whether or not they're, like a 6-year-old?
Well, I think that this is going to be very hard. This is going to be very difficult, and we have to weigh the pluses and the minuses of keeping kids out of school far outweigh the positives that will come from them being in. So we're going to work together to have the best results possible with our kids in our school and use the protocols that we think will be most effective.
Hey, Governor.
Joel.
How will you know whether this approach is working? Let's say 3 or 4 weeks from now you have 20,000 kids and teachers who have COVID. At what point do you reassess and say, this is not working, we need to come up with something? Or are you planning to stick with this no matter what?
Well, that's a bit hypothetical. From the beginning of March, we've not known what was coming, and we have made decisions based on data on information, on actually what's happening on the ground, and that's how we'll make decisions going forward. We'll watch. Nationally, we'll watch. There's going to be a nationwide experiment in this, but it's a nationwide commitment to kids. That's why most states and most school districts are doing this. But we'll follow the data, and we'll make decisions just like we have throughout this entire pandemic.
And then I wanted to get you to elaborate a little bit more on what you said about the masks earlier. I think you're going to issue an executive order you alluded to empower local governments. Why not still issue a statewide mask mandate? The AG just said it's constitutional. You can do it.
Yeah.
You say that, you don't think it's effective to have this. But if it's effective for local governments, why isn't it effective for the state to have a mandate?
Well, because I believe that that anything that's done closest to the people is most effective. And when it's possible, we ought to make decisions locally that affect local citizens. I think that people have trust in their local elected officials. And those officials can speak to their communities. The local health officials can speak to their communities. The private sector there can. And that is how you get sustainable buy-in in a community.
And then I have one last question for Commissioner Piercy, and maybe you want to answer this, but will the Tennessee Department of Health release public data on a school-by-school basis, a la what you guys did in nursing homes, in terms of deaths and cases of COVID?
Yeah, so that's a good question, and I'll remind you of kind of the issue when we started with the nursing home reporting. Until CMS gave us clearance to do that, we didn't feel comfortable putting that out because of the risk of re-identification. So just like in nursing homes, schools can choose to disclose that if they want. We just saw that happen in Alcoa City Schools. And I think it's highly implausible that in the age of communication and information sharing that we have, that it will be a secret if any case comes in a school. The department will not be publishing that list, but I fully expect schools will oftentimes be able to tell parents, and it'll be their responsibility.
This question is probably also for Dr. Piercy or Commissioner Schwinn. Under the protocols that you've been talking about, the guidelines you're going to offer districts to help make that local decision about when to reopen schools or when to close, depending on cases, would Metro Nashville schools in Shelby County, should they be opening in person then, based off like those current protocols, or?
So I think we've all pretty clearly stated today that in-classroom learning is the best and should be the starting point, and then you should work your way backwards from that. Specifically to the Department of Health, we've assisted the Department of Education in a very detailed plan of how to address cases when they happen. It's a pretty sophisticated algorithm of one case or two or more, if they're related, if they're on a team, if they're in a classroom. And so what we're trying to do is minimize the disruption and narrow the geography, if you will, of any closure to the most narrow geography possible. We don't want to put anyone at risk, but we also know that if an outbreak is contained to a classroom, it's probably not needed to close the whole building, and it would be an incredibly rare instance where an entire district would need to be closed. So that's the health expertise that we've been lending to the Department of Education to know how to minimize the disruption when a case does happen.
So for clarity on those protocols, are districts going to be expected to follow those and not what they might have already come up with their own local health departments? I know a lot of districts across the state have come up with their own. If they're more flexible or they're more strict than the states, are they expected to basically do away with those and follow the departments?
I'll defer to the Commissioner on local autonomy on that. The Department of Health has made a recommendation from a health standpoint, and that's consistent with all of our health departments, and so that's expected to be used statewide.
So I think a couple answers to that. Holistically, the Department of Education and the Department of Health at the state level have put out what we think to be a robust set of guidelines to help with that local decision making. Our expectation is that districts are starting with that framing in mind and then thinking very critically about what is required at that local level for some of the nuances that just aren't appropriate at a statewide level. Now, in terms of the school reopening conversation, I'm going to be speaking as a commissioner, a mom, but also as an elementary school principal. When we think about that going back in some of the districts as they're making those tough decisions about reopening, it is really thinking about those younger students. We need to think about literacy rates, and we also need to think about vulnerable populations, children with disabilities, children who speak a language other than English, and children who are young enough where they're not able to actually voice when they have a need. They are hungry. They are suffering from abuse or neglect, et cetera. And so when we think about the consequences and costs of any decision, we certainly understand that with school reopening, it's going to be critical, especially in some of our more urban areas, to ensure that those resources that many of our families get at school are available no matter what the format of education is, but certainly that there are consequences, pros and cons to both decisions. And for those younger students and for those that are most vulnerable in our communities, we want to make sure that we are prioritizing those and thinking about the long-term consequences of any of the decisions and not just the short-term ones.
Thank you. And my last question is for the governor. We've seen the state assist with getting COVID tests to prisoners, to nursing homes. Is there going to be a way to ensure that teachers, students, and their families have access to robust testing? And
Well, as you know, we provide free testing to anyone in the state. And the challenge we have right now is test result turnaround time, but I was on a White House call today and met with Dr. Birx yesterday here talking about how it is that we can improve that turnaround time. And there are improvements in those turnaround times already, but every Tennessean has access to free COVID testing, including teachers and students and families.
Okay, 2 questions for Dr. Piercy. Yesterday, the State Department of Health confirmed 300 people were incorrectly told they are being traced as positive COVID-19 cases because of a coding error. Was that the fault of the state? And if so, do you all accept responsibility for that?
So let me provide some clarity on what happened. So there are basically 2 scripts for when a contact tracer calls you. And they're just callers with a script that go right down. In fact, the script may be posted on our website. They're pretty standard. One is for what we call case investigation. So patients who test positive, they get one set of questions, very detailed, where have you been, who have you been around, those kind of things. The other one is for contact monitoring. So you would get a call and you would say, hey, you've been identified as a close contact of someone that was infected. 300 people got called with the wrong script, and so they were asked questions as if they were a case instead of a contact. No one was given inappropriate lab information. No one was told that they were positive. There were no labs, no lab errors there. They basically just got asked more questions than they normally would have. That was recognized in less than 24 hours. It was immediately stopped, and we've put safeguards in place to happen again. So really, it was just the wrong words that were asked, and we've got systems in place.
So would that error be on the state then?
I don't know where the coding error was, but ultimately, quite frankly, I'm the commissioner of the department, and I take responsibility for anything that happens in the department.
Okay, second question for you, Commissioner. We know of one case among the 300 where a man was not COVID-19 positive, but it was told by several tracers that he was being tracked as a positive case. Are you aware of any other cases like that?
I am not. The only other piece of information that I'm aware of is that for these 300 that got the wrong script, this was not their first contact. And so they were immediately alerted to, hey, this is different than what we than the previous calls. I'm not aware of any other than the one you referenced.
Thank you, Commissioner.
Thanks.
My question is for Commissioner Schwinn. On the 80,000 kits provided to teachers, when will those kits be distributed, and will priority be given to teachers going back to school in person?
Yep, so just make sure I heard your question. When will they be distributed and how are we prioritizing that delivery? Yep, so 2 great questions and glad to be able to get the opportunity to talk about it. So we have those kits. They are going to be distributed through TEMA. Again, cross-agency collaboration on that. So TEMA will be distributing those. Those will be prioritized based on school reopening dates to make sure that we can get those out. They are currently in process. Same thing with the face masks that are going to be provided to anyone in a school community who wants and needs one. Those are happening in real time and all are in process right now. So we are moving very quickly. They will likely go in batch shipments over the course of the year.
And also, you mentioned that at least one school in the state has already reopened, with several more opening in the coming weeks. What is the department doing to help implementing these new guidelines very quickly?
Sure. So we are in regular contact with superintendents. So first and foremost, we have calls 3 times per week with superintendents. We also do at least once, oftentimes twice or 3 times a week, individual follow-ups with individual districts. We're prioritizing districts as they open. So for the district that is already open, we've been in contact with that superintendent. And then for the couple of districts who are opening this week and next week, a lot of them are doing staggered reopening. So I know Sumner County had their first school open up yesterday. We are in contact with their instructional leads or their superintendent to ask if they need any additional supports, resources, or technical assistance from the state. So I think that's the kind of communication that has been accelerated over the course of the last 6 months. And frankly, as we think about getting districts the resources they need, these are some of those critical moments, and we're just very grateful that we'll be able to provide teachers and families with what they need to be safe and get a high-quality education.
Hi, I think this will be for the commissioner. A child gets sick, tests positive. Obviously, they're going to go home, 14 days. What's the reintegration process? Do they have to test negative? And how will they be helped during that 14 days or whatever with their schoolwork while they're at home?
Yeah. I can address the health part, and I'll take a stab at the educational piece and rely on Commissioner Schwinn if I misspeak. I believe your question was, if a child tests positive, then what happens next, essentially. There's a bit of a distinction that is important to make about isolation versus quarantine. When you test positive, you go into an isolation period, which, as long as you're asymptomatic or symptom-free at the end of it, is only 10 days. It's 14 days for quarantine, which is what happens when you are in contact with a case. But it's very important, whether you're at the end of isolation or at the end of quarantine, there is not a need to test at the end of that. CDC came out last week and actually made a pretty strong statement that if you're asymptomatic, you should not be retested within 3 months of a positive test. And so after those 10 days or 14 days, as it were, isolation or quarantine, you are clear to go back without another test. As for education during that time, as long as the child's well, I would suppose they could go to a remote learning option. And as we mentioned, most children, most children are going to be asymptomatic or have mild symptoms that should still facilitate that participation.
I'm going to just answer a little bit on the remote. So every district has that continuous learning plan, or CLP. Those are the plans that are due. They were due last Friday, and we're in the process of reviewing them. Excited to be able to say Hamilton County, Knox County are the 2 most recently that have been approved as of today. But those remote learning plans can happen for a single child, for a group of students, if a classroom happens to be closed, or more. So they are intended to be flexible exactly for those requirements. All of the approved plans will be posted on the Department of Education's website.
Dr. Piercy, do we have enough tests? I have a 2-part question. The supply side, do we have enough on hand? Are they distributed properly? Are people waiting in line and then they run out of tests in some of the places? Or that's one part. And then this is not related to school. This is in general, okay? And then the second part is the governor referred to it. Do you track the average turnaround times for the various labs that we have, and your own, your lab too is one, right? And what is that average, and is it good or bad?
How much time do you have?
We can talk later. That's fine.
No, to answer your first question on testing supply. So there's a bit of a distinction here that we need to make about test kits or swabs and testing availability versus lab supplies. This is a bit of a different narrative than what we would have discussed 90 or 120 days ago. We are really not seeing any supply chain issues with test kits and collection or testing sites. So another way of saying that is you can get a test pretty easily and pretty readily. And with now about 1.4 million tests done in Tennessee, it's pretty clear that people know when and where to be tested. The distinction that I want to make is that now the supply chain issues we are having are on the lab side, which feeds into your second question about lab turnaround time. So labs are having difficulty getting what's called reagent, which is a chemical that they need to run the test, and they are recently starting to have difficulty finding some of the supplies, pipette tips and other things that is just a result of the entire nation's testing demand being more than the supply chain can handle. So because of not only those reagent, those lab supplies are in short supply, we are having enhanced throughput, which means longer turnaround times. And I didn't look at the lab turnaround time before I came in here, but last time we were here, it was just shy of 3 days, 2.84 days at the end of last week. It may have changed a little bit since then. However, I want to be clear, as I was last week, that doesn't mean you get your tests back in 2.8 days because there's transportation time as well as reporting time on the back end. Some labs are a lot longer than that. Our state public health lab is a little longer than that, maybe 3 or 3.5 days. Some of the large national labs that are having to deal with national demand can be upwards of 5 to 7 days. And so every single lab knows that they need to do whatever it takes to reduce turnaround time. Actually was just on the phone with one of our commercial lab partners about an hour ago, and he was very clear about his needs and very clear that they were doing absolutely everything they could to try to minimize the turnaround time. So we'll continue all of those efforts both in the state lab and supporting those in commercial labs.
Could I ask a follow-up on what it, could you talk to us a little bit about what is the significance if you're going to have an effective contact tracing and everything? I've heard different numbers or whatever. Could you just tell us a little bit about why it's so important to have a quick turnaround?
Sure. I can tell you that if it takes 7, 10, heaven forbid, 12 days to get a lab test back, your contact tracing is essentially a moot exercise because not only have you allowed that person, they should be at home quarantining while they're awaiting their results. They could have potentially exposed persons during that time frame. And likewise, if they test negative, they were unnecessarily out of work and out of their activities when they didn't need to be. So excessive lab turnaround time has extensive implications, and that's why we're really motivated to get it down as much as possible.
Governor, that's all the time we have today. If you'd like to close.
Thank you all. Appreciate your attentiveness through what we believe is an incredibly important time to communicate with Tennesseans about the importance of opening schools. It's an issue that impacts thousands of families across this state, and I'm again grateful for the partnership that we have had from the Department of Education with local school districts, with teachers, with families, all across the state to make sure that we can get our kids back into school, but do so in a way that is as safe as possible. And we believe that that is the strategy that we've developed. We're encouraged about the direction we're going, and we're thankful for the partnerships that's made that possible to happen. Thank you for being here.